Gears to health matters now. The Ministry of Health is assuring the public that there are a sufficient stock of HIV commodities, including ARVs and testing commodities. The ministry maintains that it is committed to sustaining HIV, AIDS, treatment and prevention programs. Despite the announcement of the withdrawal of the USA from the World Health Organization, as well as the freezing of global health and aid, including the President's Emergency Plan for AIDS Relief, PEPFAR, stated by former US President, that is George Bush Jr.
The Ministry of Health, through Director General Dr. Patrick Amoth, is assuring the over 1.3 million Kenyans living with HIV that there are sufficient stocks of HIV commodities in the country, despite recent reports of massive shortages and the reaction of major policy changes in health funding policy by the U.S. government. Additionally, the ministry says it has strengthened the supply chain pipeline to ensure continuous availability.
I want to assure Kenyans that we have sufficient stocks of HIV commodities, be it antiretrovirals, be it the testing commodities. We have strengthened our supply chain pipeline in the last 1-2 years to ensure that at any given time we have more than 6 months of stock.
The ministry says that 1.2 million of Kenyans living with HIV have achieved viral suppression. However, many fear that the fight against HIV has now received a major blow following the decision by the USA to halt funding for global health. This new development now poses a potential disruption to HIV treatment to hundreds of thousands living with the condition, as well as increased drug resistance and a possible rise in mother-to-child transmission, which has since been brought down from 15% 10 years ago to the current 7.1%.
We are lagging behind in terms of viral suppression slightly. We are at 94% against a global target of 95%. And one of the biggest contributors to our failure to achieve the 95% in viral suppression is in regards to elimination of mother-to-child transmission of HIV.
All Kenyans living with HIV have been urged to turn up for treatment without fear or delay.
I want to appeal again to all members of the community, family members, to ensure that those who are on treatment go to the facilities to be able to receive their medications, because we have the medicines and the healthcare workers to be able to provide that service.
To address the funding gap, the government is focused on strengthening local capacity. Additionally, investments are being made in local pharmaceutical manufacturing to reduce dependency on external sources and enhance the resilience of the country's supply chains.
Right, now to a news item that will form the basis